Cervical dysplasia, or cervical intraepithelial neoplasia, is an atypical transformation of the epithelial cells of the cervix without invasion of the stroma. In simple terms, it is a change in the cellular structure of the cervical mucous membrane, which is a predisposing factor for the development of cancerous processes in the female reproductive system. There are 3 degrees of dysplasia. The first is mild, the second is moderate, and the third is severe. In the first case, changes occur in less than 1/3 of the depth of the mucous membrane, starting from the main basal layer. At the same time, changes at the cellular level are minimally expressed. With second-degree dysplasia, the cells are morphologically more significantly altered, and the lesion extends to about half the depth of the epithelial layer, starting from the basement membrane. With third-degree dysplasia, more than 2/3 of the depth of the mucous membrane is affected, and the cells are morphologically significantly altered. A mild degree of dysplasia does not at all mean that it can be ignored and nothing needs to be done, because mild dysplasia can progress to more severe stages and lead to oncological processes. Cervical dysplasia occurs in women of different age groups, both in women in their 20s and in women during menopause. The causes of cervical dysplasia are as follows. First and foremost, these are infections that are primarily transmitted sexually, as well as early onset of sexual activity when the formation of all the functions of the cervical mucous membranes is not yet complete. This also includes abuse of alcohol and nicotine, in other words, harmful habits. This includes frequent changes of sexual partners, multiple childbirths, and frequent abortions, during which the cervix is subjected to trauma. There is also a genetic predisposition. The main role in the development and occurrence of cervical dysplasia is attributed to the human papillomavirus, especially its oncogenic strains. The causes of the appearance of dysplasia can also include prolonged use of contraceptives that affect hormonal balance as well as hormonal imbalances themselves. Most often, cervical dysplasia has a latent course, and a woman may not suspect anything for a long time. However, if there is an infectious process, a woman may notice the appearance of vaginal discharge with a specific color and odor. Given the fact that in most cases cervical dysplasia is asymptomatic, the only way to detect it in a timely manner is to attend preventive checkups with a gynecologist once a year. During the examination, the doctor collects the necessary tests, including a cytological examination from the cervical canal and the surface of the cervix, as well as samples for testing sexually transmitted infections, and also performs a colposcopy. This is an examination of the cervical mucosa using an optical binocular device, which allows for a detailed assessment of the mucous membrane and enables examination at a magnification of 10 to 30 times. If indicated, a biopsy is performed, meaning a small piece of tissue is taken from the cervical mucosa for further histological examination. The course of treatment for cervical dysplasia is selected individually. First and foremost, this involves medication treating the diseases that were the primary factors leading to the development of dysplasia. With first-degree dysplasia, complete recovery is possible after eliminating the underlying disease that caused it. However, if after treatment the pathological focus is not completely eliminated, then, as with second-degree dysplasia, the doctor resorts to surgical treatment of dysplasia. This includes radiowave treatment or laser vaporization of the cervix. In the first case, radio waves are used, and in the second, a laser is used, with dysplasia being destroyed by vaporizing the pathological area. Diathermic excision is also used. This is the removal of the pathological focus using an electrosurgical knife or an electrosurgical loop. For third-degree dysplasia, consultation with an oncogynecologist is primarily recommended. Women who are planning a pregnancy need to treat dysplasia before becoming pregnant, because during pregnancy dysplasia may progress. To prevent the development of cervical dysplasia, it is necessary to visit a gynecologist regularly every 6 months for cancer screening. Vaccination against highly oncogenic strains of human papillomavirus, such as types 16 and 18, is also used for the prevention of dysplasia. For these purposes, the vaccines Cervarix and Gardasil are used. Vaccination is recommended for women who have previously been diagnosed with cervical dysplasia. And vaccination is carried out only after the treatment of dysplasia.